Good evening, 105.4 Radio Spice, full to twisted पर मैं हूँ ब्लॉन्डल आपके साथ. शो चल रहा है सबकी 5 बजे की, which is brought to you by Al Zahra Hospital, Al Barsha, Dubai, Care and Style. और इसी हॉस्पिटल से हमारे साथ है जनरल पीडियाट्रिशियन डॉक्टर समीना अजमल, who is going to talk about influenza virus and it's actually a kind of a flu या फिर it's not a kind of a flu, I don't know because I'm not a doctor. तो इसीलिए डॉक्टर समीना is going to talk about this more. So doctor, is influenza a kind of a flu?
Yes, of course. Influenza is a type of flu. Flu actually is partially derived from the word influenza. So, but then there are a lot of other stuff also like cold, common cold. So people generally call everything a flu. But influenza is let's say a bad type of flu, but it is caused by influenza virus. And it occurs mostly in winters and spreads from person to person. So it's a bad type of flu, let's say. So, but this is influenza season. So we are right now in influenza season. So we should know something about it to take proper care of. And I'm a pediatrician, so I'll be dealing mostly with kids, but generally also. It's the same precaution for everybody. Yes.
मैं वही पूछना भूल गई आपसे. इस मौसम में सबको फ्लू हो रहा है, so इस मौसम में आप कैसी हो? By the way, इतने सारे पेशेंट्स को देखती हो आप.
No, we get sort of immunity. Seeing so many patients, we do get some sort of immunity. But this year has been really a bad year, bad influenza year, because we get a lot of patients every flu season. But this season particularly I would like to get through to everybody in telling you that this season has been really, really, very bad. We've seen some very atypical cases and a lot of complications. And so everybody should get the flu shot in this season. Because I never take flu shots and I never do get influenza. But this year I also got some flu-like illness, and my husband, who's also a doctor, got influenza, and then I took some medicine also for influenza, and then I took the shot because.
So, doctor, are there many types of flus in influenza? Are there different types?
Yes. This actually influenza virus is a very atypical virus because it is a very strange virus. Every year it changes. And it's very interesting you must have heard about, there are a lot of, other types of bird flu, swine flu. So these actually are all, types of flu. So every year the virus changes. And then we have a new vaccine. That's why the flu shot needs to be taken every year, because every year the virus changes. So, that's a atypical thing about this virus, that it changes every year. It's not the same. So some year it's like swine flu, some year it's like bird flu. So it's all the same types. And then you must have heard about swine flu also.
Yes.
Broadly speaking, there are 3 types of flu. This is ABC, so it's named as ABC type. So the influenza A type is the one which, is mainly related to the severe types of influenza. And the type of influenza which is now ongoing here is H1N1, which is again also referred to as swine flu. So this is like, it's known as swine flu because I get a lot of patients and they say, no, we don't eat, pork. We will not be getting, no, you don't have to eat pork to get it. And it's not from pigs that you will get it. It's, pigs just act as a vessel for mixing of these, genetic material of flu.
Yeah,
so it originates from the pigs. And then it comes to humans, and then it's spread from human to human.
So basically, it is contagious whether you eat pork or not.
Yeah. It doesn't matter. I mean, it's not coming directly from the pork. It's coming from, and it, interestingly, it happened, it originated originally from China, where, the poultry and, of course, the pigs and humans, they live in close contact with each other. So the cycle was completed and then it spread to the whole world.
So doctor, what are the symptoms and how is this influenza different from common cold?
Yes, that is a very good thing because most of the people, they neglect and keep neglecting their influenza, thinking that it's a cold and it will pass. And a lot of complication happens because they just delay the treatment and delay everything. Now, basically, influenza is a severe type of cold. Okay, so generally speaking, the symptoms of influenza are the same as of cold. Like the person will have moderate to high grade fever, will have a dry cough, will have some headache, will have a sore throat, chills, runny nose, loss of appetite, muscle pains and tiredness. Okay, this is same like a common cold, but this is more, severe. So that's the only difference that, this is more severe than that. I mean, it's like as if somebody is just, torn you apart or just, it's like such writhing pain in hands and feet, and the fatigue is very extreme. And the cough similarly is like, the cough is too bad. Not like a common cold. Just thoda sa nazla zukam ho jata hai. It's not like that. It's like quite severe. The chills are like shaking chills, and there's shortness of breath, difficulty in breathing, and especially in kids is more, severe. But adults also, when they get the fever, when they get influenza, they can tell that this is influenza because you feel as if somebody is taking life out of you. You can't, you feel so bad, depressed, your mood gets, you feel, it's not worth living, that kind of a thing. So it's quite extreme.
So doctor, कैसे आपको पता चलता है कि like when to seek help? What is that stage where you should go and seek help now from a doctor? You can't stay at home and have antibiotics or nothing.
Yes. So most of the people with flu recover within, mostly 3-4 days without treatment. And the temperature is not very high, and that is with the normal cough and cold and flu. Even with influenza, most of the people recover within say on 6 days. That's it. But the serious complications of flu, when it happens, then you should immediately contact the doctor. For example, if you have very high fever like 40 and above. Or you feel short of breath, or having trouble in breathing, or you have pain, or you feel as a pressure in your chest or stomach, or you have signs of being dehydrated, dizziness when standing, or you feel confused, or you have some kind of mental confusion, dizziness, and you are vomiting, or you cannot drink fluid. Sometimes the loose motions are too much. For children, actually, also, if the child is, skin color is like abnormal, like sometimes blue, in cases of high-grade fever, their extremities are blue. So that again is another indication that this is influenza and this has to be treated.
Okay.
Or if they are so irritable that he doesn't want to be held and cries a lot and has fever, very high fever, and very lethargic and not accepting feed. So these teachers definitely they should seek help.
So doctor, what is the treatment for this, and are there any possibilities that now we travel in, some people travel in metro, we contact a lot of people, we are in contact. So are there any things like how can we avoid this, or can we have like a treatment, like you said, you spoke about a flu shot. So what are these things and how can we avoid this influenza?
Yeah, influenza actually basically all the treatment and everything is mainly general. The grandma's recipes that we used to use for when we were small. The same things, that rest. You have to rest until the flu is fully resolved, and especially if the illness is being severe, the rest is the single most important thing to do. Because people continue, and nowadays kids are having exams, so when they are having exams, the parents will just push them to go to the school, and then they get tired, and then it worsens. Or even if we are, going to office, and then we are like thinking, maybe I'll get better tomorrow, so we keep on doing it. Some people are going to gym, and they are like, they continue doing that. So then you are adding insult to injury, and then, when your muscles are tired, and your muscles are producing lactic acid, this virus gets, more, and it attacks the muscles. And then you feel fatigue, and then again the kind of a relapse, and it becomes very severe.
Huh.
Then drink enough fluids, liquids, so you do not become dehydrated. So in children it's more difficult. In adults, yes, we can drink lots of fluids and try to consciously,
Yeah.
look for the color of your urine, because not to get dehydrated because you have so high fever. And then simple, paracetamol, Panadol will be okay to relieve fever, even for kids, and just the normal Panadol.
और इतना सब करने के बावजूद भी अगर किसी को टेंशन हो रहा होगा that they cannot take care of themselves, then you can always go and meet Dr. Samena at Al Zahra Hospital or Barsha. So
Yes,
doctor,
anybody is welcome. Anybody is welcome anytime. Anytime. But we have and then herbal cough medicines, honey, all these things, they do help in flu. But there is also specific antiviral treatment especially for influenza A. And that has totally revolutionized the treatment of influenza, especially severe types of influenza. So and we have a very easy testing method for influenza, and it's not blood test, it's just a nasal swab. So it's just from the nasal swab, and within 1 hour the report is there. So we just do the nasal swab, and then the report comes, and if it's influenza A, we further check for the swine flu, the H1N1 subtype. And we start the child or the adult on medication. If one person has it, then the rest of the family also has to take this medicine. And especially if it's a severe flu, or if there's like a very small child or elderly people there, or a pregnant baby, they have to definitely take this treatment. And it's a medicine by the name of Tamiflu. And this really, within 24 to 48 hours, the flu symptoms, they completely disappear, and you feel good, and everything taken care of.
Okay. And doctor, अगर किसी को आपसे मिलना हो, आके टेस्ट करवाना हो, so where they can find you?
Yeah, I'm there in Al Zahra Hospital.
What are the timings?
Yeah, I'm there every day except Mondays. I'm there, and I'm 3 days I'm evening shift, so I'm there till 8 o'clock. Every day, like Saturdays, Sundays, and Wednesdays, and Tuesdays and Thursdays are morning, so I'm there till 4 o'clock.
So now you know where you can go and meet Dr. Samena. Go to her, get yourself checked, and get rid of influenza. Thank you so much, Dr. Samena, for being with me on the show. And itna sara अच्छा ध्यान दिया
आपने. And get vaccinated too. Vaccination is the most important
thing. Yes, get vaccinated too. Very much important.
Any child above 6 months, I strongly recommend getting vaccinated, because this season, I usually recommend vaccination only for children, very small children, or, who have bronchitis. But this year has been really bad. It's been like so much of influenza. Children are getting continuously sick. Children going to nurseries, kindergartens, they are worse at, risk. So everybody should get vaccinated for influenza,
Get yourself vaccinated and go and meet Dr. Samena. Thank you so much. मैं हूँ ब्लॉन्डल आपके साथ, and शो चल रहा है सबकी 5 बजे. Stay tuned.